This is the first time this has happened forever for Social Security since, 1935. Politicians have been trying to destroy Social Security since 1935. 83 more checks as everybody's Social Security is going to be cut.
Beginning March 7th, a series of major operational changes are expected inside the Social Security system. These updates could affect how Medicare applications are processed, how Social Security cases are handled across the country, and how people access assistance from the agency. For millions of Americans who rely on Social Security and Medicare benefits, these developments are drawing growing attention. One reason is that the system is already facing serious staffing shortages.
Even before Doge and Elon Musk came in, they were at a 50-year low in terms of staffing.
With staffing levels already near historic lows, the Social Security Administration is managing a massive workload. The agency processes retirement benefits, disability claims, survivor benefits, and Medicare enrollments for millions of people every year. To deal with these pressures, new administrative systems are being introduced. Two of the systems being implemented are the National Appointment Scheduling Calendar and the National Workload Management System. These systems are designed to reorganize how appointments are scheduled and how cases are distributed across the country. One of the biggest operational changes involves Medicare applications. Automation and artificial intelligence are expected to play a larger role in reviewing these applications.
Starting next month, they are going to pretty much automate a lot of Medicare applications.
For decades, Medicare applications were reviewed by trained staff. Employees would examine employment records, verify insurance coverage, and determine whether someone actually needed to enroll in Medicare immediately. Medicare itself was created in 1965 under President Lyndon B. Johnson, and human review has traditionally been part of the process.
When you file an application for Medicare, a human being looks at it and checks it and everything like that and approves it or whatever.
This step is important because not everyone needs Medicare right away. If someone or their spouse has health insurance through an employer with at least 20 employees, that coverage may qualify as creditable insurance. In those cases, enrolling in Medicare Part B immediately may not be necessary. Avoiding unnecessary enrollment can save thousands of dollars each year.
There's going to be a lot of people that are paying for Part B that shouldn't be paying for Part B.
Another major change involves how Social Security cases are assigned. Historically, applications were handled by the Social Security office located in the applicant's local community. Staff in those offices often knew exactly where a case was being processed. But under the new workload system, cases may now be routed to offices anywhere in the country.
So you could be in Florida and your case is going to be sent to Washington State, to Nebraska, to Kansas or something. And so there's no telling where your case is going to be.
A nationwide routing system may help distribute workloads more evenly between offices. However, during the early stages of implementation, some experts worry that mistakes or delays could occur while the system adjusts.
And a lot of people are going to be losing their cases.
Social Security currently operates a network of offices across the United States that help people apply for benefits and resolve issues with their accounts.
There's over 1,200 offices in the country.
However, many offices are dealing with reduced staffing and increasing demand for services. In some cases, applicants may experience longer wait times or difficulty getting help. People facing urgent situations, such as losing a job, losing health coverage, or needing to start Medicare quickly, may need assistance right away. Applicants seeking disability benefits may also face long waiting periods. In many cases, disability decisions can take 6 to 9 months. Another option sometimes available to applicants is contacting their elected representatives. Members of Congress can submit what is known as a congressional inquiry, asking Social Security to review the status of a case. Beyond these operational changes, analysts are also watching the long-term financial outlook of the Social Security program. Several reports suggest that the program's trust funds could face financial pressure in the future if no legislative changes are made.
And then your check is going to be cut. And they say 20 by 21%.
Different projections estimate that future benefit reductions could reach around 20% if the system's finances are not addressed. Some critics argue that the administrative changes currently underway do not solve the deeper financial challenges facing the program.
What do they say? Shuffle the deck chairs the deck chairs on the Titanic.
At the same time, staffing shortages and increasing workloads continue to affect customer service throughout the system.
Customer service will get worse, worse, worse.
As these changes continue to unfold, millions of Americans who depend on Social Security and Medicare will be watching closely. Automation, staffing challenges, new workload systems, and financial concerns are all shaping the future of one of the largest government programs in the United States. Understanding how these developments affect applications, benefits, and services may become increasingly important for current beneficiaries and for those planning to rely on Social Security in the years ahead.